Hi guys. So continuing our series on Reddit posts, we have come up with another case where a patient is seeking advice. What do you think, guys? Is it possible to get good result, or am I too far gone? Started shaving bald at 21 and now I'm 27 years of age. Let it grow for 3 weeks to show you guys. And the pictures patient has shown, he's quite bald. There is thinning which is present throughout the scalp. And if you see this, the definition of hairline is still you can make out. And if you look at the back picture, you can see gaps in the donor. You can see there is thinning which is affecting the upper portion as well as the lower portion. So the donor zone is actually shrinking.
Satya Hair Solutions,
where trust meets expertise.
There are a lot of suggestions which have been made to this patient, where people are telling him to go for medicine first and then do a transplant. There are people who are discussing about the side effects of the medicines. You must have seen such cases all across all the transplant clinics, be it in US, India, Turkey, everywhere you will find similar cases being posted and shown as grade 7 transplant results. And all the patients or people who see it, they feel that it's actually a great transplant and they think that a wonderful job has been done. But have you ever thought what happens with the medicines? Now, some people are telling him to take the medicines first, grow the donor in thickness, and then go for a transplant. And it is not just donor which is growing. These hair also grow. If you see this case, for example, a kind of similar case, maybe just little more thickness in the hair, and he took medicines for almost a year or so, and you can see how his hair growth has improved and the entire portion is filled completely. Now, if you see this case, this patient was actually suggested a hair transplant with 4,000 grafts, and he was around 40 years of age, not losing hair at a rapid pace, and still he was suggested 1 mg finasteride, which was to be started after the transplant. So he did not go for a transplant. Instead, he took this medicine for around 4 months, finasteride 1 mg daily, and you see the results which he has got. Entire portion is filled with so much of density, and that is not it. But look at the condition of his donor, which has again improved significantly. But in this patient, he developed sexual side effects because of the medicine, and we had to stop the medicine. So all the growth which had come because of medicine will obviously go away. And if he wasn't really losing hair at a rapid pace, he was stable, he actually did not need it. In such cases, just a plain transplant can be done. No medicine should be given to these cases where the hair loss is stable. It is an unnecessary burden on the body. And why would someone introduce a medicine with potential side effects into the ecosystem? Don't get me wrong, I'm not against the medicine, but I'm telling you, whosoever needs the medicine, in only those cases, medicine should be given. And there is a concept of microdosing also, where if we give less doses of medicine, still you find improvement, as you can see in many of my cases, where I give it at 1 mg or 2 mg per week and still get a decent coverage. So the primary aim of giving the medicine should be stop the progression of disease or reduce the speed at which hair are thinning. So for that, microdosing can be used. You may not necessarily go for high doses, 1 mg per day. Many cases you will find there are issues of tolerance, where they keep taking the medicine for 1 year, 2 years, and then they will find that the same dose is not working, and then we have to step up the doses. My suggestion to this guy is, if you choose for a transplant, don't try to fill too much. A diffuse kind of transplantation can be a great idea in such cases before starting the medicine. In case you start the medicine at high doses, don't go for a transplant then. 1 mg per day probably will fill the entire portion up, including the crown, middle portion, and even the frontal hairline. And it is always advisable to start these medicines at lower doses. If we give high doses is like US FDA approved 1 mg per day. People say, oh, 1 mg is FDA approved, you take it. There are studies where microdosing has been shown to work. And it gives you a window where you can, in fact, increase the doses still remaining in safe limits. But yes, the effect, the free credit and free hair, which a surgeon is going to get with 1 mg finasteride would be less when we give 0.2 mg or maybe lesser dose. So hair restoration is an important decision of your life. Don't rush things. And next time, whenever you see a result, you judge, you choose a surgeon or a clinic, make sure that the results which you are watching are pure hair transplant results, or at least keep in your mind that this much contribution can be coming through the medicine, which will force you to overrate your surgeon's skill and your donor, and eventually creating a big gap between expectations and reality, and you are gone. So if you want to really understand the concepts, you can visit our website, satyahairclinic.com, and there is a blog section which you can read in details. So there are more than 800 videos on our YouTube channel, almost covering everything A to Z of hair transplant, medications. The link is given in description. The playlist is given. You can go and watch that. Thank you. Love yourself. Stay blessed.